Those boys have been through enough. I'm not gonna bring them in here to have her reject them again.
She won't. Let's just have a little faith. Okay?
What the hell is this?
You'll see. You can bring them in. It's okay, Hannah.
Well, if this doesn't work, they are going to live with their dad today.
I know.
It's a risk. Mom? Why are you wearing that?
Gus?
Yeah, Mom. It's me.
Mom? Alice. Get over here. Both of you. Come here. These are my boys. These are my babies, I know it.
I gotta call my mom.
I don't understand what's changed.
Good question. Think of the brain as an intricate network of connecting roads and highways. When we look at an object or a face, the messages travel down those roads to the temporal lobes where it's identified, and then it takes an exit and it goes down to the limbic system. And let's think of that as home. Now, this is where we generate the appropriate emotional response to whatever it is that we're looking at. But in Hannah's case, that exit was damaged during the surgery, so she can't get home. To cope with this disruption, her mind creates this elaborate delusion that her sons are imposters. But there are other routes that she can take to get home. The part of the brain that connects from the auditory cortex to the amygdala was not damaged. So that's why when Hannah hears Gus and Ellis, she identifies them as her sons and feels that connection. She loves them. She's home.
Doctor, I appreciate all this, but I can't agree to give her kids back if she's gonna be in a blindfold for the rest of her life.
But you saw what I saw today. Hannah is a mother who loves her children unconditionally. Just give me a chance to prove that she can care for them. Give her a chance. Jessie said she feels disembodied. Don't you think that's such an odd word choice, so specific?
Well, our psyche eval came back benign. Jessie did say that talking to you made her feel better. It's not surprising. You've always had a way with your patients. Whatever it is you're doing with them, you should try it with your mom.
Is this her signature?
I think so. She filled out her consent with a surgical resident.
No, it's completely different. Look, it looks like it was signed by somebody with a different hand. Perhaps by somebody who feels disembodied. When did she sign this basketball?
About 2.5 hours ago.
And the consent form?
Less than 30 minutes later, you think she's declining?
Yes, and fast.
You are not listening to me. I said I don't want to do this.
You will
Swear
feel
to
so
God.
much calmer when the
I do
anesthesia
not-
kicks.
How are you
Stop.
gonna foot-
Hey,
Jessie, what's going on?
I was laying there, getting ready for surgery, and something changed. My body is like I'm not in it.
you mean like your nightmare?
It's coming true.
When you retired, you were in your prime. Were you hiding an injury or something?
I was just ready.
Well, it couldn't have been that easy. I mean, you were a star. You averaged like...
Sure, I was scared to leave the game. But once I did, I knew it was right. When I started coaching, something just clicked. I knew it was what I was supposed to be doing with my whole life.
You know, I was a quarterback back in the day. Played D1.
Damn, how'd you end up in scrubs?
One too many concussions.
It seems you got a good head on your shoulders, even if it is a little banged up. If I can't walk again, can't move, I don't want to let my girls down. This is a tough place to grow up and a tough time to be a kid. Am I gonna be okay?
Hey, Coach Shay, you have plenty of courtside huddles left and you trust me. Okay, and while you're here, we're your team. And we're not giving up until we fix this. I promise. Just try to get some rest. I think I know the cause. Smoothies. Jessie drinks them all the time and they're loaded with supplements. Then I rechecked her blood work and her B6 levels are high.
So the pyridoxine toxicity from the B6 could have caused the proprioceptive damage, which means
There's hope.
Step outside yourself. Don't worry about the entire cadaver in front of you. Start small. Just focus on your hand. I believe in you. Enough for the both of us.
we're taking out Jessie's tube. We're gonna stop her Presidex, reduce the vent settings to minimal support, loosen the breathing tube, get ready to deflate the cuff.
Dr. Wolf, she could die.
Yes, she can't breathe on her own.
Jessie can't move her body because she's suddenly blind to it. It's overwhelming. But what if she steps outside of herself? What if she uses her other senses to control her body? We're starting small, focusing on one body part at a time. It's not that her muscles are weak. It's not that she can't breathe. She can. She just doesn't know it yet because she has to learn to connect with her body in a brand new way. And the longer we wait, the weaker she gets and the more she loses hope. I mean, we don't believe in her. How is she supposed to believe in herself? Let's get in there. Let's do this.
He gives locker room speeches now.
Clear eyes, full hearts, can't breathe.
Jessie? Will you run a drill with me? Just the two of us. When we take out the breathing tube, I want to see your breath on this tray, okay? Now, in order to do that, I want you to embrace your feelings of disembodiment. Look at yourself from the outside, focus on your chest in space, and then use your eyes to imagine it moving. Can you do that for me? Step outside of yourself. Start small. One breath. I know you can do this, Jessie. I know you can. Come on. I believe in you. Enough for the both of us.
You guys seriously want to put a 12-year-old on beta blockers for the rest of her life?
They're non-invasive. They're also proven to work in similar cases by reducing the abnormal neurocardiogenic reflex. I take them for anxiety and I am thriving, along with increasing her fluids and salt. Good work.
Van's got a point. Parents just want their kids to be happy. I mean, imagine if Emily was your daughter. Would you want her to spend the rest of her life on mute?
If it's between that or no life at all, ask any parent and they'll say hard yes.
I get that. Okay, I do. Right, but coming from someone who blocks out as much of the world as I can, because you're right, Jacob, I freak out around patients. Right, but I know firsthand that that's no way to live. Okay, especially not for a kid.
Wolf wouldn't want Emily's only option to be diluting joy just because her brain's different.
Technically, neurocardiogenic syncope appears to be a problem with the brain. Okay, but we all know now that this is more a problem with Emily's heart.
We don't need to suppress her brain.
We need to support her heart.
All right, Emily, you ready? This time we're gonna monitor your heart rate. The pacemaker should keep your heart beating no matter how much Curly makes you laugh.
No schnapps. Oh.
Okay, so we backtrack, retrace the bride's steps, and we should lead us to the groom.
But even if she does remember, do we even have time for that?
We need to get inside her head.
Well, then that's exactly what we'll do.
What? Oh,
Dr. Wolf, did you just take drugs?
Putting myself in the same state of mind as the bride will help us understand what she's trying to tell us. I can feel how she's feeling, think how she's thinking. We must see the world through her distorted lens.
It's kind of smart.
And dangerous.
It's nothing I haven't done before. This woman came to us for help. So unless anyone has a better option, let's start with a hotel. Who's coming with me?
Dana.
wow. I hate you.
Hey, let's go find our groom. Do you think that libertine in the club is okay? He probably needs surgery. Rhinoplasty, perhaps? That is such a good word. Rhinoplasty. I could fight a rhino.
No, you can't.
What did you just take?
My anxiety meds.
Suppressing what exactly?
You are stressing me out.
Okay.
And I'm officially done with this conversation.
We all have darkness, Dr. Dang, huh? I'm not a violent person, but you saw it in me tonight, just like the bride, huh? I could have killed that man.
Okay, this is getting dark. You didn't kill anyone.
More avoiding, huh?
You took ecstasy to help Bridget, but I'm starting to think you're escaping whatever demons it is you're dealing with.
We're all escaping something. It's part of the human experience. We all just do it a little bit differently, right? Oh my God, I'm burning up. I really feel unstable. It's like I'm suffering from neuroleptic malignant syndrome. I am on fire. I have to get in that freezer.
Okay, now you fully lost it. We're not putting you in a freezer.
The newlyweds. Cold feet, a room like ice. The groom. Oh, God. Charlie.
I don't feel anything. Should I start CPR?
No, it's there. His pulse is weak, but he's alive. Hey. Anything revealing in Charlie's stuff?
Just, rental tux and some breath mints.
Dana, about tonight, I'm sorry. I crossed a line. Asking you what you're suppressing, it's none of my business, and I was wrong to even assume.
It's fine. You were high. Small price to save a life, right? Oh, this might be something. It's vows. You are my pancake. You smell like Vermont in the morning. You have never been sweeter than you were these past few weeks. Check it out.
Syntax is atrocious. Charlie, you told us they changed their diets, cut out sweets.
The steak in their hotel room.
Vermont in the morning evokes maple syrup, right?
If you're saying what I think you're saying, her tube feeds are currently killing her.
It's Most likely just a reflexive motion related to muscle spasticity, which can happen to patients who are paralyzed. But the passion that you two showed around this tonight, that is what's necessary. It doesn't always get us the result that we want, but we can't do what we do without it.
What is it?
That's not a reflex. What? I don't think this man is in a coma. He's in there. He's conscious. Whatever you did worked. It looks like you've given our patient a reason to stay.
I got some intel. My Navy buddy couldn't give me much. As expected, the military's pretty buttoned up, but I was able to find out a little, and it turns out that Dr. Moore was right.
Steve and his unit never saw any combat.
It's a relatively new strategy. Minimize the number of soldiers on the ground, while units like Steve's pound the enemy with artillery fire.
So he was miles away from the front lines.
Which is why he and his unit never suffered any combat-related injuries, not one single casualty during their deployment. And yet, since returning home...
What?
It wasn't just Aiden Miller. More than half the unit is dead. Some from unintended drug overdose, but others by suicide.
Gotta go.
Something happened to him.
Something happened to all of them. Okay.
That's right. Just gonna put your thumb. There you go. Okay, now put the front sight on the target. Bracket it by the rear sight. Okay, squeeze the trigger.
The impact, the shock, it's like a blast wave through my arms.
Now imagine that. From a gun 1,000 times bigger, 100 times a day, every day, for months.
So Steve's brain injury wasn't caused by enemy blast exposure, but by firing his own weapon.
It's a theory that we can only confirm by analyzing Steve's brain post-mortem. Thankfully, our patient is still alive.
But there were others who weren't so lucky. Let's call Carol.
Any updates, Dr. Kinney?
Yeah, hormone levels are normal, SED rates and CRP are flat, and their fundoscopic exams are perfect.
Now, none of their symptoms are tied to an underlying medical condition, which means blindness is just another functional neurological disorder.
But because we're still worried about what could happen, all the girls have been admitted overnight for observation. I'm headed to see the last parent out now.
Does this mean no more school trips? I can't do 17 again. Again.
You're good. I just passed out grippy socks and name tags for your face blindness, Dr. Wolf.
Okay, Erica coming in clutch. Okay, it's highly likely that one of the girls is our index patient. The distress signals are clear. We just need to find out why, and fast. Without treatment, our index patient's odds of a good long-term outcome dwindle by the minute.
Hey. Jacob told me you were on edge at the school. You good?
Hmm?
Takes me back to my a cappella days.
Oxytocin. Group singing is behind the girls' groupthink because it releases oxytocin.
The bonding and belonging hormone.
It forges the neural pathways that promote behavioral harmonizing and connection. It biochemically primes the brain for mass hysteria to take root and spread.
So there's not just a social barrier separating the girls from the world, but a biological one?
Exactly. To navigate their oxytocin-induced bond, we need to become a part of the group.
How? Navy SEALs will crack before these girls.
Along with them. No more observing the group. Now we enter it. There are a number of things that could have caused this, but most likely it was a deep loss of a parent or a coach.
Or a fellow student. A few months ago, one student withdrew. Sweet girl. Her parents felt homeschooling was a better fit.
What's going on?
One of your false pregnancies is going into false labor.
Hey, just move.
Hurry! You have to help her. She has to be okay.
Wait, who is she?
I shouldn't gossip about my students. It's just she was friends with Sarah and the others. Maybe it was a blessing in disguise. Spared her getting caught up in all this.
Do you happen to recall her name?
Of course. Samantha Lee.
Who is Samantha Lee? I mean, there's no record of her. She didn't come in with the others. We didn't examine her. She must have snuck in.
We were scared. We didn't know what to do.
Brianna, I'm gonna need you to call her parents. We might need to sedate her.
You okay?
Look at me.
Whoa, Van, are you okay?
She's having a baby.
Yeah, no, false. It is in her head.
No, for real. Look, she's having an actual baby, like right now.
We found our index patient. 5 months ago, Samantha Lee found out she was 3 months pregnant. As we all know, high school is a stressful environment filled with anxiety. When Sam's parents discovered her pregnancy, they pulled her out, setting off a chain reaction that no one could have predicted.
Guys, they're taking me out of school. What?
Our girls had to not only navigate the removal of their friend, but also mourn the fact that Sam was growing up without them. A double loss of friendship and innocence. About a month ago, our witches snuck out to cast their spell. They'd conjure pregnancies of their own, that way no one was left behind, and Sam would feel less alone, protected by her coven.
No one was more devastated than Sam's best friend, Sarah. Her grief went so deep, it manifested physically as pseudocyesis, an actual false pregnancy. Sam was the friend the rest of the group was taking their cues from. Drawing upon anything to keep their friendships alive, mass hysteria spread through the group with their spell as the origin.
Every teenager experiences a rite of passage, but these girls were able to share a collective coming of age together. This illness was empathy in its deepest form.
Okay. Okay, so when do we tell them? They can't go on thinking they're pregnant.
You're exactly right, Jacob. Our first step, to meet them where they are, so they know that no matter what, they're not alone.
Neuro exam is stable, vitals are good. Roman is on track for a healthy recovery.
Nice work, Dr. Nichols.
Now that the device is in, are we installing apps into his mind?
Sometimes when I close my eyes, I see Candy Crush.
We're like calibrating the decoder. I'm showing Roman words on a screen, and then he's saying them out loud in his head.
So his brain signals correspond to different words.
Like sign language with neurons.
We're reading his body signals as he tries to speak.
Which, after the training, will allow him to generate words of his own and sentences.
And it'll translate from Russian to English and vice versa?
Yes, I've programmed a tool for just that purpose. The initial phase of training protocol is complete.
So now what? Do I just
talk to him? Just like you would any other patient.
Hi, Roman. Is there something you'd like to say?
This is worse than the 3 dots when someone's texting you.
Is the language model working?
Maybe check the cable connection.
He hasn't used words in a really long time. He might just need a second.
Wait. Something's coming through. Scratch my nose.
Okay.
He says thank you.
Dr. Dane, I hear you're a whiz at tracking people down on the internet.
Some say whiz, others genius, queen, the missing face in Ocean's 8. But yes, I am your cyber sleuthing girl.
I need to find a patient who's gone radio silent. I did a Google search, nothing came up, and I'm worried.
What's her name?
Allison Whitaker. She's a PhD student at NYU.
Oof, common name. Try cross-checking her with hospital records.
Okay. She used a hyphenated name on one of her intake forms. Allison Zhang Whitaker.
Okay, this is weird. I found her, but according to Google, she's a med student at Columbia. And it looks like she knows your husband.
Hello? Anybody here?
My paintings aren't for touching.
I'm so sorry, I didn't mean...
Did the gallery send you? Was it Angelica? God, that woman is like a dog with a bone.
I'm not with the gallery. My name is Dr. Oliver Wolf. I'm a neurologist at Bronx General. Miss Delaney sought me out.
Look, I'm fine. I'm sure there are people who actually need your help, but that's not me. Sorry you wasted your time.
I understand, but it would bother me if I didn't ask. Miss Delaney mentioned the headaches.
Haven't you ever told a white lie, Doctor? I was just trying to buy a little extra time with my work.
Oh, okay, I'm sorry that I interrupted your day. Are these both yours?
That's from a while back, Paris, 1994.
Blue bananas. Interesting.
Weren't you leaving?
How long have you been colorblind?
Colorblind. You say it as if I just mistake red for green. Try. All I see is black and white. Everything's like burned charcoal. So unless you're here to tell me you can fix that, there's the door.
What'd you guys get?
Hospital records. Post-car accident. Strangely, doesn't look like his head trauma was severe enough to even cause color blindness. I mean, his previous doctors didn't even order a CT scan. I'm not sure head trauma would even be the cause.
He said it started the morning after the accident.
Hence the mystery.
Check this out. Police report from Gabriel's accident. He was trapped in the car for hours before someone found him. He wasn't alone.
A fatality.
His ability to see color isn't the only thing Gabriel lost that night.
He lost his wife. How you feeling? Pedialyte and aspirin.
Super. Got a doctor who prescribes groceries. What are you doing?
I think I left my wallet at the bodega across the street.
Hold on. Your wallet's on the counter by the cash register.
What? You can see that in the dark?
Yep.
Are you able to read what I just wrote?
You don't have to do this. My commissions are due in 2 weeks. I have nothing to show. So I'm officially relieving you of your duty to uphold the Hippocratic Oath or whatever.
Please, just indulge me. I can't read that in this light. Can you?
You wrote my dead wife's name. Okay, so what does that mean?
that you can see what others can't. It's incredible. Without color, your brain must be sensitive to wavelengths of light undetectable by the typical eye. What's too dark for most people, your eyes are able to see.
And how do you explain the rest of the time? When I can't even make out objects at all. The cars are just floating headlights.
Right, because the color of the car is likely too similar, a wavelength of light to its background, so they disappear. They blur together into one form.
Dr. Wolf, I tried to paint using my memory of color. I did what you said, and it didn't work.
I think what we need to do is narrow your focus. Filter the light you see. In essence, we can give you an entirely new way of seeing.
Guess I should have listened to Dr. Dang about that CT scan. You're not gonna hold it against her, are you? My stubbornness shouldn't get anyone else in trouble but me.
It was a good lesson for Dr. Dang. And while you may be a stubborn patient, luckily I am a very stubborn doctor. With some good news, your CT scan is normal, so no sign of head trauma from the fall.
So, I was right. I'm fine. Well, if it isn't a bleed, then what's going on?
We're still waiting for results from your spinal tap, but your white blood cell count is up to 25K, so I've started you on vancomycin and ceftriaxone.
I have an infection.
It's very possible that you were exposed to some pathogen through your job. We have to rule out all possibilities.
The ambulance is a thunderdome of infectious diseases.
Tell me everything. Spare no detail.
I'm on the road by 0500. First stop, West Bronx, for 3-car pileup. There was a motorcyclist. I know you're one of them. But this one, he wasn't wearing a helmet. He was COA.
Well, that's an awful shock of adrenaline in the morning.
Next up, intoxicated female who refuses to comply. Has a history of drug use. I tried to save her sedation, but maybe that was a mistake. She's a frequent flyer.
When you say frequent flyer...
Oh!
Okay.
Let's save the questions for the end.
Okay.
Someone's grandpa. Who we thought had the flu. I end my day with Lucia, 14-year-old female who just came out to her parents. She attempted suicide when they rejected her. I get a lot of these. I tell her that she's not alone, even when it feels like it, and that I too was scared to tell my parents. But one day, she's gonna be okay.
Takes a lot of resilience to do what you do.
Right back at you. Most of my patients end up at hospitals like Bronx General.
But it's different when you're a first responder on the front line. At the end of the day, the come down must be brutal.
There's no come down if you never stop.
You're febrile, 102.5, even with the antibiotics.
The spinal fluid results are back. It's meningitis.
The headaches, the fever, it all makes sense. I don't think Grandpa had the flu.
Dr. Wolf, he died within 24 hours.
Katie, that story is not yours. Now that we know why you're sick, we can fight it head on.
Katie basically lives in the rig. Figured it'd be worth checking it out.
I must admit, I'm impressed, Dr. Nash. This is pretty outside the box, even for me.
The ampicillin's working, but why is she immunocompromised?
Let's say the tank was leaking. Could hyperoxia impact immunity?
Tanks are full. There's nothing out of the ordinary.
Check this out.
What is a prescription pad doing inside a paramedic's ambulance?
Hand it over. Perks of being a nosy snoop as a kid. If you shoot over the grooves.
You can see what was prescribed.
Prednisone? Why would Katie steal an RX pad to prescribe herself steroids?
My teammates used to stash stuff like this all the time to self-medicate injuries, especially if they didn't want Coach to know, to stay in the game.
Her wins. She said she was tired, but she's in pain.
And hiding it to keep her job.
She could go to jail for this.
Jean, I'm just gonna check your pulse.
He's been doing that tapping thing a lot lately. I don't even know if he notices that he's doing it, but it seems like it could be some sort of tic.
Shh, 1 second.
I know what's wrong with him.
It's pulsatile tinnitus. The rhythm that he's been tapping, it's his heartbeat. He's been hearing it in his ears.
Which means this may not be a stroke after all.